Hi, my name is Justin Brinkley, and I'm here to talk for a few minutes about seizures, what they are, and some of the medications that we can use to treat them. Seizures can be pretty frightening, even for experienced nurses at the hospital, much less for family members at home seeing a family member have one for the first time. We have nurses at the hospital that have worked for years, and they get a patient that has a seizure. If they're not used to it, it can be terrifying. For nurses who take care of them regularly, it becomes routine, and it's not such a big deal. So seizures come from an imbalance in the chemicals in the brain, largely called neurotransmitters. Some of them, like GABA, can inhibit activity. There are other ones that promote excitability. And if those get out of whack, the ones that promote excitability can take control and cause a seizure through a positive feedback loop. Uh, when a seizure happens, it just depends on the cause and location, what it looks like. There's the one that everybody thinks of, the grand mal seizure, where the patient will uh, fall and tense up and shake and stop breathing. There are seizures like petit mal seizures, where they just sort of blank out for a second in the middle of talking and then go back to it like nothing had happened. Um, you can also have partial complex seizures or seizures where the patient just acts strangely. This is a problem for things like law enforcement who don't know what they're seeing, and they think a patient is a patient, a person that they're dealing with is just being unruly, but in reality, they could be having a seizure, and that's caused some pretty serious problems in the past. So, education is important. Um, so, I think it's important for me to go ahead and get into the medications that we can use to treat seizures. Some of those medications, there are several different kinds. One that we often use nowadays is called Keppra or levetiracetam. It's a different kind of medication. It acts a little bit differently than most seizure medications. It modulates neurotransmitter releases through creating a protein or through the synthesis of a protein called SV2A in the brain. This basically, uh, one way to look at it is that it takes up all of the lanes in the highway, that SV2A protein, and slows traffic down, keeps seizures from happening by just taking up the neurotransmitters. Another medication that we use is gabapentin. Gabapentin is weird. Its actual medication of action, mechanism of action, is not fully understood when it comes to seizures. It mimics GABA, which, as I'd said previously, can lower activity in the brain, but it doesn't bind to the receptors. So, it seems like, oh, it mimics GABA, that's how it should work, but it doesn't. It does, however, in studies, it's shown to increase the mood in patients in the studies that have taken it compared to placebo. So they think, maybe um, it helps prevent triggers or emotional triggers and things that can uh, promote seizures. Hello. Uh, there's also Ativan, a benzodiazepine. We use those a lot to treat seizures. It's a CNS depressant. It binds to receptors and amplifies the sedating effects of GABA. So this helps slow things down and stop seizures sometimes right in their tracks. So interactions wise, we'll start with Keppra again. Keppra doesn't get processed the same way as other medications in the liver, so it's not been found to interact with other seizure medications or very many medications really significantly. And this is really important with anti-epileptic drugs because interactions can often be a factor in deciding what to use and balancing them. And so Keppra not interacting with much of anything is huge. So it can often be tried without worrying about that. Gabapentin doesn't have any severe interactions, but it does. It interacts with things like hydrocodone and morphine or valerian, things that sedate and enhances those sedative effects and that feeling of euphoria. So uh, sometimes you have to be careful with that. Ativan, the benzodiazepine, interacts with basically anything sedative again, It enhances those effects pretty heavily. So you've got to be very careful mixing it with other things, other anti-epileptic drugs, pain medications, or even gabapentin. When we use it in the hospital, we have to watch very closely for respiratory function and things like that. Uh, Talking about efficacy, Keppra, going back, is very effective at controlling seizures, especially as an add-on therapy. But at a lot of hospitals, mine in particular, we use it as a first choice in prophylactic seizure control for patients that have things like brain trauma, tumors, hemorrhagic strokes, or any other mechanical cause of seizure. If we want to keep a seizure from happening, we'll put a patient on Keppra. Or if someone has a seizure and they've never had one before, Keppra will be the first medication that's tried. Because it doesn't interact with very much. It doesn't have a whole lot of side effects compared to some of the others, and it seems to work well. So that's usually the first one that's tried. Gabapentin usually is just used as an add-on therapy for partial seizures, or in my hospital, it's usually used for non-epileptic seizures because of the uh, mood-enhancing benefits that it sometimes can help reduce anxiety and things like that. Most of the time, when we see gabapentin, it's used for other things like neuropathy, neurogenic pain, and stuff like that. Ativan is very effective at stopping seizures, especially when other medications won't. Uh, and it can stop them while they're happening, like immediately. So we usually use IV Ativan at my hospital as a primary tool in stopping a seizure that lasts more than a couple minutes, or seizures that just keep happening over and over again. Going into safety, Keppra. With Keppra, any anti-epileptic medication you want to monitor for suicide, and that's a big one with Keppra as well. Drowsiness. Sometimes in the elderly, often we'll see hallucinations or behavior changes. Sometimes it can alter sleep. So it's important to watch out for those kinds of things. Gabapentin doesn't have any risk of overdose, but a big thing with it is the euphoria that it can help uh, increase with opioid medications and stuff. It amplifies that feeling, and so if you're trying to get off of one of those medications and you're taking gabapentin, sometimes it can help. It can hinder you getting off those medications. It can cause trouble if a person is trying to be treated for addiction. For Ativan, safety wise, like I said before, you really want to just closely monitor for sedation, respiratory effects, watch those vital signs, and monitor for signs of drowsiness. There's also the hallucination type issues and interactions with other sedatives. Cost wise, they're all pretty cheap. Keppra, especially generic levetiracetam, you go 60 pills, 500 milligrams. That's one pill twice a day, which is kind of the standard starting dose. It's around $10 for that prescription. That's according to Good RX. Gabapentin is about the same, 60 pills, 300 milligram caps. So one pill twice a day comes out to about $7.50. And Ativan, for 1 milligram tablets, one a day, so 30 tablets is about $7. So none of them are terrible, which is great for seizures. Something that you really can't stop taking your medication with. Unfortunately, a lot of people do, but the medication is cheap enough that it's less of a problem than it could be. For expected outcomes, we hope to see with any of these medications the reduction in the seizures, hopefully stopping them completely. Um, that's all about seizures. Thank you for your time. Have a wonderful day.